guys, what's up? I hope your day is going well. I'm just drinking some water here. I'm playing catch up with my hydration because this morning the city of Houston with no warning turned off the water to our apartment and to the surrounding areas. I guess they were fixing a water main leak. So I didn't get my liter of water in this morning. I want to sit down and film this video for you guys because you have been asking me to do some videos talking about Sure Skin. Just looking at my viewer demographic, over 90% of my viewers are women in the ages of kind of 30s, 40s, and then 50 plus. So this is topical to you, and I hope you all enjoy this. But as women, once we begin to get wiser, we experience age-related decline in ovarian function, and that has a variety of outcomes on our total body health and all of our organ systems. And so your skin is your largest organ system, and it certainly has some specific effects on the health of your skin and mucous membranes, which I will get into today. But menopause is defined as cessation of the menstrual cycle, so that is definitely a positive. You no longer have to deal with, well, you may consider it a positive. You no longer have to deal with your little monthly visitor. So that is what menopause is marked by. But also, before menopause occurs, you can start having the symptoms related to declining estrogen levels, declining ovarian function, in a period of time known as perimenopause. And perimenopause can occur anywhere from 2 years before the onset of menopause up to 8 years, kind of varies. That's going to be guided by and large, like everything, your genetics as to when that starts. In terms of our testosterone, though, women make testosterone, and when we go through menopause, something unique kind of happens or is thought to happen to our testosterone levels. First of all, you actually have a decreased production of testosterone. That's the male hormone. Not only do you have a decline in testosterone, but you also have a decline in production of something called sex hormone binding globulin, which is a protein that kind of shuttles hormones around in the body. And the ultimate result of this is that you actually have an increase in the amount of free circulating testosterone. To understand this, I'll paint a picture for you of a child's playroom. And the child has a ton of toys, but they are all neatly put away in a series of cabinets. And the mother comes in and decides she's going to Marie Kondo the child's toys. And she gets rid of about 50% of the child's toys, but she also gets rid of the chests that are housing the toys. So when mom first walked in, there were a few toys on the floor, but now that mom has Marie Kondo'd all of the child's toys, what's left over now doesn't have a storage unit and is now on the floor. So the room actually looks messier than when mom first went in and Marie Kondo'd it or got rid of everything. So hopefully that helps you understand. It's not that there are more toys. It's not that there is more testosterone. It's just that it's out and available for you to trip on. In terms of our skin, is that estrogens are actually essential for production of something called glycosaminoglycans, which are kind of the meat of the deeper layers of the skin. They're the proteins and structures that keep the skin hydrated, plump, and strong. And the production of those start to decline with age. Those components also hold on to water in our skin and keep our skin hydrated. So as we get wiser, we lose hydration in our skin, and our skin barrier also becomes less strong, and so we are more prone to what's called transepidermal water loss, or the loss of water out of our skin, and subsequent dryness. When the skin becomes dry, it is more susceptible to becoming itchy. So itch is also another skin change that is common. Collagens are really important in our skin for structural support, strength, and elasticity, and overall firmness. And non-perimenopausal, menopausal skin, there are two main types of collagen in the skin, although there are many, but type 1 collagen and type 3 collagen. And normally type 1 collagen is about 90% of the collagen in the skin, and type 3 collagen is about 15%. Type 1 collagen is really responsible for the strength, and type 3 collagen is responsible for elasticity and firmness. And so that production of those start to decline with age. You have, not only do you have increased transepidermal water loss, dryness, you're more likely to have itch, but you also have a decrease in firmness and suppleness, and your skin is more susceptible to injury, it is thinner, and it is more susceptible to bruising as a result of that atrophied, thinner supportive structure. So what you need to understand, and what is very important for the care of really any skin, but very, very much so for mature skin, is consistent use and very diligent and almost to the point of being aggressive use of a nice moisturizing cream to the body and to the face. You really need that more so than ever with maturity. And because of what I told you about the age-related decline in some of these proteins, the age-related decline in your skin's ability to function as a barrier to maintain hydration, some good ingredients to select in a moisturizer include things like niacinamide and ceramides. I've talked about these in my moisturizer videos, so go back and check those out. Moisturizers that are occlusive and seal in transepidermal water loss will help to keep your skin hydrated, since you are more susceptible to losing water from the skin. Good occlusive ingredients in moisturizers include things like shea butter. You don't have to, here's the thing though, you don't have to go out of your way and get some expensive cosmetic cream. You don't need some expensive special mature skin eye cream, moisturizer, serum. This is the stuff you find in the drugstore and is very effective. And honestly, it is what I recommend. I don't recommend any specific serums, toners, mists, etc. for mature skin. It's not necessary. What is necessary is focusing on consistent use of a moisturizing cream. I am a fan of the CeraVe moisturizing creams. CeraVe's Skin Renewing Night Cream is a shea butter based moisturizer with ceramides in it. You guys, many of you are a fan of this particular moisturizer. It's a good one. I recommend it, as well as their moisturizing cream in the tub. Can be used to the face, the body. Is really going to address that barrier component. Comment below if you guys would like a full review of all of the purple line of CeraVe. I haven't done that yet. But there are many other products in this line, so comment below and if you want a full review. But in addition to CeraVe, La Roche-Posay makes a fantastic ceramide-based, niacinamide-containing moisturizer, the Toleriane Double Repair. They also make a nice, occlusive, thick, shea butter-based moisturizer called the Cicaplast moisturizer. I swatched that on for you guys in a recent video. So those are great. I will list down below in the description box some of my favorite moisturizers that are fantastic for mature skin that really does need some extra addressing in terms of barrier function, skin hydration, and preventing transepidermal water loss. As we get wiser, as we get more mature, the need for bathing goes down. We're not producing as much sebum, as much oil, and we're not sweating as much. So the need to rinse the skin, cleanse the skin really goes down. And the more you bathe, the longer you are in the shower, the more transepidermal water loss you subsequently experience. So it's important to keep your bathing to no more than once a day, no longer in the shower. Don't stay in the shower, in a hot shower, for any longer than 10 minutes. I know it's really hard, but that would definitely be the tip. And then as soon as you get out of the shower, that is a time to really total body moisturize. So that is definitely a tip. And then the other thing that is really helpful and recommended for mature skin that is really trying to cope with excessive dryness is to get a cool mist humidifier. I use one in my bedroom and I love it. So that would be the recommendation for dryness, skin dryness, mature skin, really needing some extra TLC, particularly in the perimenopause period and menopause, when we're getting used to some of these changes. All this dryness is reminding me to drink my water. Side note, while drinking water and maintaining good total body hydration is important for your overall health, and to a certain extent, obviously the function of your skin. If you are battling dry skin, the approach to rectifying that is not to just drink more water. All that serves to do is to keep your renal system going, and you end up waking up late at night having to use the restroom, and that disrupts your sleep. So, drinking water is important, but don't overdo it. I think people way overemphasize how much water you need to drink. And if you are coping with dry skin, drinking more water is not going to fix the issue. The mucous membranes of the lower urogenital tract are very sensitive to estrogen. In dermatology, people forget, they think we're just skin, but mucous membranes falls in the purview of what we treat as well in dermatology. And age-related decline in the function of the mucous membranes in the urogenital tract is something that manifests in dermatology clinic all of the time. I mentioned, the mucosa is really reliant on estrogens. It is reliant on estrogens for blood flow. So as we get wiser, blood flow to the vaginal mucosa declines. Also, the glands in our urogenital tract that produce lubrication and moisture, they also are responsive to estrogen. So as those estrogens decline, you have less lubrication that is made. And this shows up in so many different symptoms and concerns that it's definitely very important to address and to not neglect. I know it's a kind of an area where people might feel a little uncomfortable, but like the skin, the mucous membranes of the urogenital tract, they're a barrier, and that barrier relies also on the functions of estrogen. So as we lose estrogens, our urogenital barrier is not as robust, and as a result, we can experience age-related increased risk for not only urinary tract infections, but also an increased risk of bacterial infections. The bacteria that normally colonize the vaginal mucosa, lactobacilli, they go down in number, and so the normal pH that is kind of dependent on that resident microflora, the normal pH of the vaginal mucosa starts to go up. It starts to become more alkaline, and this puts the individual at risk for dryness, colonization with yeast, candida, so having little yeast infections is not uncommon. These are all things that can occur in an age-related manner. And I think women are really, there are studies showing that women are really resistant and embarrassed to talk about this with their healthcare provider, but I want to encourage you to bring this up. Not only is it important for your overall emotional health, not to neglect your sexual health if you are experiencing painful intercourse, it's also important for your urogenital health and the health of those mucosal membranes. You don't want to be at increased risk for infections, and you don't want to be suffering with pain. Pain of the vulva and vagina is very common after menopause, and it's not something to hide in the shadows about. And use of a lubricant is first-line treatment for vaginal dryness, painful intercourse. That is actually a first-line treatment, so no medication required. And vaginal lubricants used before intercourse can help quite a bit, and vaginal moisturizers used on a daily basis can also help alleviate some of that discomfort. But there are some important features to look for in a vaginal lubricant. One of them is that it should be water-based. You can find water-based, oil-based, silicone-based. and water-based have the safest profile. We really don't know too much about the oil-based lubricants, and actually there is evidence that using oil-based lubricants, as well as gravitating towards trying to use vaginal douches, female different women's hygiene, cleansing washes, deodorizers, all of those things can actually really alter the pH of the vaginal mucosa and put you at risk for something called bacterial vaginosis, which is not a very comfortable condition, and you don't want to put yourself at risk for that. So I actually encourage you guys to avoid the use of douches, female wipes, washes. They actually are associated with a lot of problems in the female urogenital tract because the mucosa is a lot drier. It's more susceptible to irritation, and it's more susceptible to changes in pH. So I don't recommend those types of things for anyone. But particularly in the perimenopausal and menopausal years, they're really not a good idea. But a water-based lubricant is a good idea and can be really helpful. The lubricant ideally is water-based and needs to be not only a vaginal pH, similar to vaginal pH, but also it needs to kind of mimic the constitution and kind of what's called the osmolality of vaginal secretions. And there are a variety of them over the counter. You guys always ask me to recommend some, and I am a fan of the Necessaire Sex Gel. It is a water-based lubricant that is pH 4 to 5, which is perfect. And it has sodium hyaluronate in it, which most water-based lubricants do. That's fantastic because that's going to function as a humectant. The mucosa is now more deficient in that. It'll help to keep the mucosa hydrated. So it's named the Sex Gel, which is a little tongue-in-cheek, but that's what it's for. And your sexual health is not something to take lightly. Importantly, this is FDA approved as a vaginal lubricant. It can also be used in men as a penile lubricant as well. It is optimally pH'd at 4 to 5. I already mentioned it has sodium hyaluronate in it as well as it's water-based. So it is ideally formulated for this and is not going to be irritating and is going to help in restoring the pH of the vaginal mucosa. A key feature of it that we don't know about non-water-based lubricants is that it is compatible with natural rubber latex condoms as well as polyurethane and polyisoprene condoms. So that is very important. Just because you are getting wiser does not mean that protecting yourself from sexually transmitted infections is a moot point. You still need to protect yourself from those conditions, and this is compatible with those forms of protection. So that's good. It offers benefits, as I mentioned, moisture, improved comfort. But a nice thing about this formulation, the water-based lubricants, they're not sticky, so they're not going to leave like kind of an uncomfortable sensation. And they're not, they're water-based. They don't have any dyes, any preservatives that are going to interact with your fabrics and stain your fabrics. They're very, very safe, and I actually recommend it as first line. And the Necessaire is actually pretty affordable. It's $20. It comes in a pump, which I think is really important for something like this. You don't want to be dipping your fingers in a water-based lubricant, so it's in a pump form. You can see there, it comes out as a nice lubricant. I actually use this myself in my nose. I'm predisposed to getting nosebleeds in the wintertime when my mucosal membrane in my nose gets dried out. So I use lubricants actually in my nose and find that helps with the nosebleeds quite a bit. So I've talked about the symptoms of dry skin and dry vaginal mucosa and why and how those are important to address. The other thing though, outside of dryness, is actually you're going to there's a good chance you might experience night sweats, which are not pleasant. Night sweats happen because of, again, changes in the hormone profile. Some women are more likely to experience them than others, and we really don't have a good understanding as to why. There's not a cream or a skincare product you can go out and buy that's going to prevent them. My tip is to keep a cup of ice with you and to put some ice chips in your mouth when you start to feel as though you're going to have a flush or a hot flash. And this will help kind of combat that increase, the sensation and the aftermath of that increased blood flow to the face. It kind of helps in a counter cooling effect. So that's really helpful. Also some ice, those cool neck wraps that you can put around your neck, very helpful to have on hand. They can be very tough to cope with. There are some medications that your doctor may prescribe that can help you deal with them. But also outside of medications and ice chips, the other thing that has been shown to be helpful for hot flashes is acupuncture. So that's an alternative, what we call complementary alternative therapy, that you might want to ask your healthcare provider if they could recommend someone in your area if that's something that you would consider. So that's an option. And then after the dry skin, the dry mucosa, the night sweats, the other thing that you guys will ask me a fair amount about is age-related changes in the hair. Age-related changes to the hair are one of those things you have your parents to thank. It's more, it's more your genetics. And as we get wiser, our hair can thin. We just have the follicle of our hair follicle itself undergoes some age-related changes, decline, and actually around the perimenopause period and the menopause period, when those hormones are really shifting around and changing, you can experience something called a telogen effluvium. Just related to the changes in the hormones, and that typically starts 3 months after the hormonal changes begin. So you may not be clued into the fact that that's what it was or is. And it usually is done within about 6 months. It's usually over. If it persists longer than that, there's some blood work and some things that need to be evaluated to make sure that there's not an underlying medical illness or some sort of stressful situation that you're going through that's contributing to ongoing hair shedding. But for the most part, in perimenopause, menopause, you can experience a period of several months of hair shedding. That is not permanent hair loss, though, so be aware of that. And then, female pattern hair loss is something that can also start to occur kind of as a result of now we have more available androgens and or now we have more available testosterone, that's kind of playing a role in our hair, and we can develop what's called pattern hair loss. I have a video on that, what's called a wide, your part gets really wide, you lose some hair on the crown, but you can also lose hair in the frontotemporal regions, just like in men. Then the other thing cosmetically that people will question or wonder about is graying of the hairs, and that's something that seems to be mostly governed by your genetics, because as we get wiser, the health and the population of what is called the melanocytes, the pigment cells that make the hair color, they start to dwindle and decrease, and as a result, you lose color in your hair, and that appears as gray. It is estimated that 50% of men and women will have half of their hair on their head be gray by the age of 50. But many people don't go gray. Many people go gray at an earlier age, and we really don't have a complete story as to graying of the hairs. And there's not necessarily an ingredient or a treatment that's going to prevent or alter that, other than hair dye. But outside of the skin, the mucosa, the hair, the other thing to think about are your nails. Over the age of 50, brittle nails, dry, peely nails, far more common. The reason is same reasons that lead to dry skin. As we get wiser, we have less hydration in our nails, and as a result, they become dry. They lose water more readily and are more susceptible to breaking, cracking, peeling. The thing that I would strongly encourage you to do is to avoid going to the nail salon and having manicures. Particularly avoid pushing back the cuticles. This only serves to worsen nail brittleness and dryness. And the reason that is that when you push back the cuticles, you are exposing what's called the nail matrix to air and to losing water. The nail matrix is what grows your nail. So if you push back your cuticles, cut your cuticles, you're only going to put your nail matrix at risk for dryness, the nail developing dryness. But not only that, when you push back the cuticles, you put your nail at risk for infections. That little cuticle is like a seal to water, as well as a seal to bacteria and yeast and fungus getting in under the nail. So strongly encourage you to skip the nail manicure. So one thing though that you can do is to use I have a video talking about urea, and I think I mentioned in that video that urea, which is an ingredient in moisturizers that is a wonderful humectant. Urea is a great ingredient to apply around the nails to help the health of the nails. It can really increase hydration. A 10% urea cream, for example, I'll list some down below, is a good choice for the nail health. Very cost effective, very easy thing to do. I have a whole video also about biotin. Oral biotin supplementation has been examined for brittle nail syndrome, taken at 2.5 milligrams per day for 6 months. There is one small study showing improvement in brittle nails. There are some issues with biotin that you guys should be aware of. So check that video out. But the urea creams, that's a good way to keep the health of your nails. So you guys always ask me all the time, I'm over the age of 40, I'm over the age of 30, I'm over the age of 50. Is it too late for me? Is there any point in wearing sunscreen? And the answer is absolutely yes, because we experience an age-related decline in the skin's antioxidant system, and the cutaneous immune system starts to decline a little bit, as well as skin barrier. And as a result, mature skin is more susceptible to sun damage. Age spots, brown spots, sunspots, all of that stuff is more likely. Not only sun damage, but can put you at more risk for skin cancer. So very important to continue to protect the health of your skin, not only through the use of a broad spectrum sunscreen, but also wearing sun protective clothing is really important. But I hope you guys enjoyed this video. Again, comment below, and if you want to see a total review of the Skin Renewing Night Cream and the Purple products by CeraVe. But I hope you all enjoyed this video. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.